the agenda. Taking now here. Okay. You may have done this, but there is a survey that is from the Indiana Food Vision to create a statewide food vision for cultivating, nourishing, and equitable food system, and they're looking for some input. So some of you may have already completed this or seen this. It's been out on the newsletters. So we're just going to take a couple of minutes to complete. If you've already done it, see if it goes through. You should be able to click that link in the chat. Okay, that's kind of a little bit of a longer survey. So we can go ahead and get started on the next topic on the agenda to introduce Miss Molly and Lydia Hall from Parkview. That's going to talk about Veggie Rx. So let them introduce themselves and go from there.
Yeah, so we are, as you know, Lydia and Molly, and we're just working on sharing our screen, but thank you so much for having us today.
Yeah.
See where we're at.
I'm Molly Trich. I am the coordinator for our Veggie Rx programs here in Kosciusko County, as well as in Huntington and in LaGrange. I did some planning for that as well. We are going to talk today about the food insecurity in Kosciusko County and the studies that we've found through Parkview, and then also what we're doing with Parkview to help with these food insecurity needs, as well as the programs and the direction that we are going into to help combat these issues. So we're going to talk about our food insecurity in our local communities today.
Can you all see our slides?
Lydia, do you want to introduce yourself?
Awesome. Yeah, so I'm Lydia Hall. I'm one of the community outreach dietitians at Parkview. So I work both in Allen County and Kosciusko County, and I'll talk a little bit later about some of the programs that I do there. And yeah, we're just really excited to share all of this information, and our team has really grown a lot over the past couple of years. So it's growing fast. We're having a great time. It's hard work, but we love it. So we're just happy to be here.
Yeah, we love Kosciusko County. And we are both the leaders of the Veggie Rx program here in Kosciusko County. We work together. So, okay, so we'll get started. This is what we're going to talk about today. I'll let you all read that, and then we'll just get started. So does anyone know what the social determinants of health are? I guess this is a little bit more interactive, but just maybe raise your hand, or if anyone has heard of what the social determinants of health are. Okay, so the social determinants of health are non-medical factors that influence health outcomes. So those are the conditions that we are born in, we grow, we work, we live, and age. And then the set of forces and systems shaping the conditions of daily life. So those would be our economic stability, our education, healthcare, neighborhoods, our community, and our social factors. So here you'll see all of those things. They all comprise us as people, and it's important to understand that these are all part of who we are and how we live. So there is a lot going on right now with studies on the social determinants of health. And the one that we like is the Healthy People 2030. So this is a national initiative that's done every 10 years to identify the needs of our communities. So Healthy People 2030 sets goals and objectives on how to improve identified health issues. And there are 359 measurable objectives. The focus areas are social determinants of health, health equity, and health literacy. And you can find this information as well as how the county is going with the goals that you've set at this website that we've listed here. It's kind of nice. I checked it this morning, and it gives a percentage of how the community is moving towards each identified goal. So, and it breaks them all down. It's very nice to see. And then these, I wanted to put this on here for all of you so that you could get a snapshot into the social determinants of health in Kosciusko County. So we see that the average income here is 70,000, and then people living below the poverty level. 2030, the healthy people 2030, once the goal is 8% for Kosciusko County. So you're moving towards that goal, not quite there yet, but I think, you know, getting there, this great group here is how we get to improving these things. And then I also wanted to share with you a little bit more. The website at the bottom of this slide there are many factors of these little cards here. But this is just kind of an overview of Kosciusko County and kind of how it pertains to what we're going to talk about today. But there are many more categories of these factors. So it's nice to see, and you can check it all out at this website below. And now Lydia is going to talk about food insecurity.
Yes, so food insecurity is a lack of consistent access to enough food for every person in a household to live an active and healthy life. And so definitely food insecurity is focused mostly on the quantity of food, whereas nutrition security, the second definition there, is really focused on quality. So looking at nutritionally adequate and safe foods and being able to acquire them in safe and socially acceptable ways. And so we kind of, as dietitians on our team, work really hard to increase not only food security, but also nutrition security. And this, sorry, looking at a couple different spots with notes and things, but this is a good diagram that shows just how Kosciusko County compares with some of the other counties that Parkview serves with food insecurity. And so the darker the blue, the higher the food insecurity rates are. Next slide. And I need 2 clicks or 3. And so there is a screening tool that is used to determine if someone is food insecure. And there are just 2 questions that are asked, and people answer whether it was true, often true, never true, within the last 12 months. They think about if they were worried that their food would run out before they got paid more to buy more food. And then they also ask, were there any times when the food just did not last? So really simple, straightforward questions, assessing really how often it's true to determine their level of food insecurity. Thank you. Our community health needs assessment identifies health needs within Northeast Indiana. So Parkview does this community health needs assessment every 3 years as a non-for-profit community-owned health system. And so our last one was it 2022?
Yeah.
2022, and then the next one will be in 2025. And so it just helps to capture how all of the counties are doing within the service area that Parkview reaches. And so it does kind of change ever so slightly. And a lot of the outcomes we saw on the 2022 assessment was really, I think, highly related to COVID. So it'll be interesting to see how things change for the 2025 results kind of post-COVID. Yeah. And then let's see.
And those findings are at that. There's a lot more on that you can find at that website that we listed there.
Yeah.
And it's free, and you can go and look at it. It's free to the community.
And we can also share some of these links in the chat. probably not right now because I think we're just wanting to like stay focused, but actually after our presentation, we'll kind of share a few of these, but we could also share them via email. Yeah, we'll keep moving. So these are some of the needs in Kosciusko County. So the top 10 health service needs are listed at the top, and then the actual health concerns are listed down there on the bottom. So you kind of see some overlap in some of them, but mental health is the biggest one, and that's huge to think about. We see so often those with lower income suffer more with their mental health, and obviously access to healthy food is a big concern for us. So and then so often the biggest chronic diseases, diabetes, heart disease, kidney disease, and cardiovascular, did I say that? Cardiovascular disease, they're all related to poor nutrition. So it's really important that we work on improving nutrition security everywhere, but especially in Kosciusko County. And then the Food Insecurity Index was created by Conduent Healthy Communities Institute. And you can access this data to show how your programming or our programming is going to be beneficial to the community. And so this is really helpful to just look at and kind of form some of our approaches based upon the findings. And you can see a food insecurity map of Allen County 2022. So this is actually
Kosciusko.
Kosciusko, sorry. Let me move this.
This is actually what we used to figure out what counties to expand in Veggie Rx with. So it showed Kosciusko, LaGrange, and Huntington had a high need of food insecurity, especially in these outlying, I'm going to use my mouse here, like right here, this is kind of like the middle Warsaw area. And so you see this darker green happening farther away. And we'll get to that, but I wanted to point that out now.
Yes. Okay. And then a lot of the programs that we do, including Veggie Rx, help to address poor dietary intake. We know that 9 out of 10 Americans do not get enough fruits and vegetables. And so that's a major thing that I share in our Veggie Rx classes and just in our community classes that are open to the public, encouraging people to gradually increase and set personal goals to really achieve more fruits and vegetables. And then we know that poor nutrition is the leading cause of illnesses like heart disease, diabetes, pregnancy complications, obesity, and malnutrition. And 1 in 5 deaths worldwide are caused by poor diet. And I wanted to tell you just a little bit more about these pictures. So these are from our Allen County cohort of Veggie Rx, I think from 2022 or 2023. And we give them the opportunity to share some kind of win that they experienced during their time in the program. And so we often see that people are consuming more fruits and vegetables, which is incredible, and can show just a change in habit that they have worked hard on over the 6 months of the program. And then sometimes we even see improvements in our lab values, like our hemoglobin A1C. So this patient saw a drastic improvement in her A1C level from June to December, and we are just so excited to see results like that. And that's why we're excited to be in Kosciusko County now. And we'll talk about that a little bit more in a second. But
she looks so proud. Her face looks so proud.
And we're so proud of her.
Yeah, we are proud of her. Yeah.
So yeah, love to share. We have a really pretty carrot wall at the Parkview Greenhouse and Learning Kitchen in Allen County. So it's a nice little photo op.
Mhm.
Okay.
This is your last one.
Okay, so this is just a little continuum of nutrition security. So kind of like we talked about earlier, there's a screening, and then we hope to help navigate through some different programs, nutrition education opportunities, and different offerings just in the community. So that could be Veggie Rx. And then following Veggie Rx, we like to share other opportunities, nutrition programs and federal nutrition assistance programs, so that people have somewhere they feel like they can go once their 6 months is finished in the program. And then seeing that they also have consistent access and availability to affordable foods. So sometimes the 6 months are enough time to really help them get their feet back on the ground, make really positive changes that help them to feel their best, and really see differences in how they're living and beyond just what they're eating. And so this can really have a trickling effect toward that consistent access to available, nutritious, and affordable foods. So it's really neat to see.
Mhm. So Veggie Rx, since this is our focus today, we're going to tell you about Veggie Rx's produce prescription. If you've heard that, it's spreading across the country. It's best practice right now. So we want it to be on all of our service areas as our goal. So each participant will receive $50 a month in fresh fruits and vegetables, and then also 4 sessions with a registered dietitian. And those are group nutrition classes, and we hold those at the Martin's.
Am I in the right spot?
The Martin's grocery store cooking school upstairs on the 2nd floor. You do need a provider referral, which most of the providers with Parkview and Bowen are aware of our programming. Eligibility is diabetes. You have to have a health condition. So diabetes or prediabetes, high blood pressure, obesity, pediatric obesity, or high-risk pregnancy. And then you also have to have Medicaid or Medicare dual eligibility, be uninsured, or have a positive screen for food insecurity questions that we had already talked about. So the history of Veggie Rx, we started in 2019 with a very grassroots effort. The pilot program was funded by our community health improvement dollars, and we had 30 participants. It was a group from Parkview that was really heading this up, and it was very grassroots. So now 2020 is when they did a pilot program with summer and winter cohorts. Moving into 2021, when I was hired, we did a pilot program. We had 122 participants, and then we were awarded the GusNet grant, which was a big deal for us, which provided a lot of funding for us to really grow the program. So Veggie Rx to Heal kicked off with 174 participants in 2022. And then we were awarded over $1.2 million for produce prescription programming. Moving on to 2023, we were continued to plan, and we enrolled over 300 participants. Also, then expansion to Huntington, Kosciusko, and LaGrange and Wabash begins this year. So how does it work? So yes, we already said you get $50 a month, but how do we do that? We partner with a company called Fresh Connect, and we really think through those grassroots efforts, the dignity of our patients was really important to us. So in that, this Fresh Connect card works just like a debit card. You take it up there, you swipe it, just like anything else. The grocery stores it is compatible with. It has a filtered spending, so it pulls out those produce items so that it can cover those. And then the cards are automatically reloaded each month. So at their first Veggie Rx education session is when they receive information on how to activate their card after after I go back and put all their information in the system, then they get it in the mail and it's activated. It's a very, very nice way to have our patients redeem at stores like Kroger and Walmart. And then also, it works and is compatible with Square. So it's also eligible for farmers to use that at the farmers markets. And we are going to be at the Winona, Warsaw farmers markets. We have partnered with Denny Farms, Holly Farms, Creation Celebration, and the Old Farmhouse. So those are all redemption sites in Kosciusko County for this year. So the nutrition education piece is very, very important. And they're very fun. The biggest thing I've taken from it is that it creates a whole community of people, which is huge, and it really sets it apart. So we give them the program overview. We tell them how and where to use the card, and that first class, they actually get a tasting. It's usually like a tomato basil salad, but it's that first taste, and it's very simple, and it's very little ingredients, and it's easy, and we can show them this is an easy thing for you to make. They also take a survey that we work with our GusNIP program. They need that so that they can help these programs evolve throughout the years. And then we do a baseline survey. So this first circle is the first class. The second circle is the second class. We talk about the rainbow produce, which is, we ask the participants what colors they know, what, say yellow, what are the yellow fruits and vegetables? And it's very interactive. We want them to talk and share ideas. We also give them a demonstration at this class of a berry recipe, another simple, easy recipe that they can make at home with very limited resources. The third bubble is the virtual or in person. So a lot of times they all choose to come in person to watch together, but our dietitians have made tailored videos to each diagnosis. So at the beginning of this presentation, we listed our referring criteria. So those diagnostic criteria fit into these videos that each participant gets at the third session. They can watch at home, or they can come for a watch party. And then they have questions to answer at the end. And then the fourth session is a review of food safety. I forgot to mention, food safety is a very important and big component of Veggie Rx as well. Food safety, knife handling, and food storage is very big. And so our participants then make 4 recipes, and then we share them with the class. The recipes are all healthy recipes from our dietitians here at Parkview. So, and they're really good. It's usually like something that you usually have, like a spinach dip made healthier, and it's really good. And then they take a post survey. So then we enter all of that information in to get and then we'll get some results back. Along with the patient's impact, we also have an economic impact of Veggie Rx. That money goes back into the community. So in 2022, participants redeemed 40,000 in Veggie Rx vouchers that went straight back into the grocery stores in the community. The spending represents the economic impact of $61,000 to Allen County. So that was in 2022. And then, we're really stressing the local food system and informing our patients to talk to their farmers and go to the farmers markets, and really stressing how that works within the communities. Participants have reported increases in fruits and vegetables consumption. And then also they want to try new foods and recipes. They like the community. And then over $70,000 has been redeemed in Allen County by 23-24. So we have 46 locations, redemption sites in Fort Wayne, Allen County area. We would love, Kosciusko County is big, and I know there's a lot of farmers here, so it would be wonderful to have a very large group of local farmers participating in this. And the local farming community has been amazing already. We have the most here in this county of all the counties besides Allen County, the most. Okay,
we'll start there. Go go to present.
And then somebody was wondering, you said the links, would we have access to like the slides at all, like the slide deck or something?
Yeah.
I'll send you.
Okay,
Mhm.
Yeah, we'll send those out.
So sorry.
that's okay.
And now it's time to start us over at the beginning.
Just
So-
tried to. Um.
So
Yeah.
as we kind of wait for the slides to catch up, can you still hear us? I'm gonna
Yeah.
just keep talking and hope
Yes.
the slides will catch up to my voice. But the next thing was on measuring food access. And we define accessibility. We define this as accessibility to sources of healthy food and measure the distance to a store or the number of stores in the area. There's the individual level resources that you might look at. That would be family income, transportation, things like that. And then there's the neighborhood level indicators, which could be the average income of the neighborhood, and also the availability of public transportation. So those are all things that help us to determine food access in any given area. And then low income neighborhoods, this is determined by the Department of Treasury's New Markets Tax Credit Program. So it defines a low income census as any tract where the tract's poverty rate is 20% or greater. And the median family income is less than or equal to 80% of the statewide median family income. And then the low access census tracts. Can you see?
Can you at least see it like on the?
Awesome, cool. Sorry
We can
about
see
that,
it like
guys.
that. That'll be fine.
Okay. I think we're
Okay.
just gonna have to do it this way.
Okay. And so this kind of shows you what is considered to be low access. A few different like breakdowns. So you can see 53.6 million people are low access, meaning they're more than half a mile from the nearest supermarket, and that would be in the urban area. And then 18.8 million people are more than 1 mile from the nearest supermarket in the urban area. And in the rural area, more than 10 miles from the nearest supermarket. And then looking at vehicle availability, more than 100 households in the tract have no vehicle and are more than half a mile from the nearest supermarket. So this is just kind of how we define low access and low income people. So yes. And then I think we're back to you,
Yeah,
Molly.
so we talk about that because we want you to start thinking about your grocery stores and where they are and your county into where are people living? Are they able to get to the grocery store? Where are the grocery stores? Can they walk? We've talked in past about like how someone can walk to a grocery store or drive to a grocery store and what the different things are along the way and time frames it will take to get there. So those are big things that factor into food access for all of our area. So it's a big reason why we wanted to expand into the rural communities. So as I said, I was hired in 2021, and that first year I worked for Parkview, I did planning. So I met with a lot of you in Huntington, Kosciusko, and LaGrange counties community, what works, what doesn't work. I got a really comprehensive view of Kosciusko County, and it really helped me to plan our community, our program in your community. We have had one class so that we are able to, because of your county and the time it might need to get the word to spread. So we're gonna keep it open for a little while.
Can you guys still hear us? Thumbs up if you
It's cutting out a little bit, in and out. So
can
I
hear
think you
us.
just said you have one class so far.
Yeah, we've had one class, and the next one is going to be in July.
Okay, in July. If anybody has questions, if you want to type it in the chat, maybe they can chat back. Yeah, because now they're logging out. But yeah, so just type it in the meeting group chat. Any updates? I have a mobile unit. I don't know, Kurt, if you have any updates you wanted to share with the yeah, either I don't remember if we were talking about the health or the clinic one.
So the mobile one, have a meeting middle of July. We'll see. There's a vehicle that could be retrofitted to be mobile health, but we'll see how that conversation goes. And the other evening, we had a meeting with 6 farmers up at Owens and Leesburg to talk about just one stream of food to go into the fresh food delivery to the food deserts in our county. So it's just one of many pieces that has to be lined up. But it was a great meeting. They were very enthusiastic and very informative.
Great, thank you. Good. And then Shannon, I didn't know if you wanted to share your updates on the Get Walking program.
Yes, so we did a Get Walking program with the Kosciusko County employees for their health and wellness program that they have. It's a 12-week email-based program that targets promoting healthy walking, getting out and walking in the community. It also encourages everyone to set a goal of what their intention is, of how they intend to promote exercise and get that implemented in their daily lifestyle. We had 98 employees through the county that participated in the program. It's a completely email-based program, so it's kind of nice. So it just encourages them to get out and walk. 67 of those 98 participants actively tracked their steps and how much water they drink on a weekly basis. And we had 8 individuals walk over 1 million steps during that program. And the program lasted from March to June. Thanks, Jessica.
Thank you so much for sharing. Does anybody else have anything to share about any upcoming programs or their current programs and how they're doing in the community? I don't see anybody. Tracy, maybe?
Yeah, so this is Tracy Frick from the director of Healthy Living at the Kosciusko Community YMCA. So we'll have a diabetes prevention class that will launch in the fall. So we do those in the fall and the spring. So that's something that will be coming up. And then also we have Rock Steady Boxing, which is for Parkinson's. That will also be in the fall at North Webster. So.
Love that. I love the DPP. Is that just North Webster for the Parkinson's one, and is it DPP in Warsaw?
Yep, DPP
Okay.
will be at the Parkview Warsaw location.
And the new downtown is open.
Yes, I'm here currently.
You're here. Oh, you're there.
Yeah, I'm there.
Are you switching offices over there?
No, I oversee both of them. So I come, I pop in, go back and forth. So my office is still at the Parkview Warsaw location, but I'm in our break room right now. So.
Well, thank you for joining in.
Yeah, no worries.
I muted myself. So I do have a question. Is there handout information? How does one refer, sign up? So I will get that information from them. I'll email them and get that back to you. We'll get the slide deck. Maybe on the next meeting, we might give them a couple of minutes if they want to touch on those last few slides. And referral process, how many, what is their capacity? Because all of a sudden we start referring and how that goes. For our next meeting, yes, Melissa. Okay, I can't hear you, Melissa. If you're maybe you.
Did you have a question about how to refer? Did Molly? I had to switch to my phone. So did Molly and Lydia log off?
They were having trouble with their internet, so I think it just booted them out. It kept we
Okay.
the last 3 slides, which was
Okay.
about
So what were the questions? Yeah, what were the questions?
Sure. Yeah, one is there a handout information, and then how
Yes.
does referral happen, and how do people sign up for Veggie?
So yeah, there's a handout and I can send those over to you. And yes, there is a referral process. It doesn't have to be a Parkview provider. I know we're going to be working with talking to Goshen about it as well in the coming months. But if it's a Lutheran provider, we're happy to give a referral form, but it does take a physician referral. So we do have those referral forms. You do have to have Medicare or Medicaid. You can have, you do need to have a chronic disease, be diagnosed with a chronic disease for that, better than this slide if they're going to send those over to you. I don't have access to those, but and then if you do have insurance, as long as you have, let's say, one of those qualifiers, and then you answer to those food insecurity questions, at least one of the two questions you answer yes to, then you would qualify for the program, which is 6 months, and it's $50 per month.
Cut out, but yeah, $50 a month on the reloadable card.
Issues at Parkview. Can you hear me?
Yeah, you cut out at the end, but we got that information. Thank you.
Yeah.
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 Thank you so much.
And then I'll send over, I'll send over the flyers and everything when we hang up. So
That's perfect. Thank you so much. And then for our next speaker for next month, this is really exciting. We have Dr. Whitney Blakely. She is from Community Health Network. It's bariatric medicine specifically. She's going to be talking about GLP-1s from a provider standpoint. So those are like some examples like Ozempic, Mounjaro, Wegovy. So I know it's the new medication, so we'll get some information of that. So it'll be really exciting. If you know anybody that wants to attend, please forward them the invite. We'll be posting about it. We'll do a recording as well, because we've had a few people say that they're working and can't watch it and they really wanted to know about Veggie Rx. So we'll put that out.